people hear that, oh, maybe he's prepared for what has been happening, is no one has been ever prepared, even if you're inside the discipline of public health emergencies. It's been quite a journey for all of us and a learning for all of us as we move in this response. Thank you very much. I will try my best to just set the scene. I think a keynote, calling it a keynote is too formal. But let me just narrate it as best as I can. Where are we right now? Where are we? And why is this discussion important? I think at this point, we are at a crucial time of the pandemic. Cases are plateauing in India after a quick dip, a very rapid decline of cases from a devastating second wave. And COVID vaccination is scaling where possible in different states, as best as possible, depending on the availability of vaccines. It's a point of uncertainty because cases are also surging elsewhere in the world. When cases are surging, we also know that there is a possibility of another variant happening. There are variants dominating and maybe new appearing. Right now, it's Delta. There is discussion and emergence of Lambda. It's a point of uncertainty on how this pandemic will evolve. But I think what we're seeing is intensive preparedness in all states in India. All countries are preparing for a possible third wave. What that third wave will look like is very difficult to model or even predict. Some epidemiologists have already said the truth of the matter is that we don't know. Some are still battling, even in India, some states are still battling that second wave, still spreading. And then the biggest question is, what is the new normal as we proceed to reopen businesses, social services, schools? This is the question in everyone's mind. We cannot keep hiding from the rest of the world and keep stopping livelihoods, education, businesses. But I think what's important for us to think about, and as an emergency person, and I've seen this so many times happening, is that this challenge is an opportunity. In all this, health has never had this spotlight and priority or an investment. Every head of state is talking about improving health services, improving health of the people. The idea being COVID-19 response as a launch pad for having ideas for better health. This is how we should also look at it as a lens. And this is, I guess, the point of these webinars, of these summits, e-summits. This emergency provided a space and resources to leverage the whole of society and government approach. And that we've seen in all countries. They have different ways of doing it, but this response or these responses wouldn't have happened without such an approach. And such ways of working need not be exclusive to the pandemic response. I hope that's the biggest learning. If there is cooperation across sectors for a response, there should be the same cooperation across sectors for preparedness, for strengthening health systems, for improving the health workforce, for improving quality of healthcare services, for improving primary healthcare, making systems resilient under the frame of universal health coverage, which includes the health workforce that is well prepared, supported, protected, health services in their reach and coverage, and of course, quality, health information that spurs action. What do these all look like? And health policy that is flexible and agile. We've seen that in this response, that age-old policies and regulations for difficult procurement suddenly disappeared, and it's possible. Why not bring that to preparedness? Why not bring that to regular work? There should be no stockouts of essential medicines or essential vaccines. These together form the base of a resilience for health and health systems. And I think if there is any country in the world also that's well positioned for UHC and a resilient health system, it is India. With the Ayushman Bharat, PMJ, operationalized through health and wellness centers. Ambitious goals, but really intense work has been happening. It's more than 50% now of the 150,000 health and wellness centers have been set up. And the amount of funding that is being leveraged for health, for PMASBY, as well as with the Jal Jeevan mission, Urban Swachh Bharat Mission 2.0, there are health outcomes that need to be leveraged. So I think the ask for the sector or the health sector or sectors is to reimagine. This is why the forum is so well entitled and captured by that word, reimagining public health. And many of you have seen me speak even last year as the cases went down. I would always say reimagine, because a rethink is not enough. Looking at lessons from the pandemic requires an insightful look back from how health professionals are educated. Are health professionals, is there a subject about pandemic preparedness response in any of our health schools, medical schools, nursing schools, allied medical professions, to how they are employed and served and protected in the health system? The other is an efficiency in health financing. Why were some of these investments that were expected to perform were not happening? Existing policies that can be improved and changed and amended. How do we leverage technology and R&D without forgetting people? Sometimes it's all about, when we say communicate now, it's social media, etc. But there are people that are not reached or use such technologies. How does technology leverage for reaching the unreached? We need to find new solutions and rebuilding back differently a resilient health system. Now, the thing is, we may already have solutions or platform for solutions that just need scaling up and need leveraging. You know, there is a national digital health mission. COWIN is one of the biggest e-solutions for vaccination registration. It's looking like a one-stop shop for vaccination for the pandemic. I can also tell you that the Integrated Health Information Platform, which is a platform for various surveillance programs for integrated disease surveillance, malaria, health management information systems, is already in place. Policy for the health workforce, why don't we think of a cadre for public health and emergencies, surveillance officers per district? I think there is a plan for that. But more so, how do we scale the skills of ASHAs and basic primary healthcare workers to be able to manage emergencies? And I'm talking emergencies across the board. It's not just a big outbreak. It may be floods, which keep happening. Even that needs some form of retooling. Health services. How do we strengthen COVID facilities and create a very efficient referral plan that can scale up for an emergency but works very well during regular times? Telemedicine, there's e-Sanjeevani already. So what are the important parameters that you need for telemedicine? Is it regulatory? Is it setting standards? From decades ago, there had to be standards for the kind of images that would be sent for diagnosis, for opinion. How well do you refer from telemedicine? You might miss something in your history, etc. You may need to see the patient face to face. When does that happen? Protocols will have to be evolved, but the platform is there. Environmental surveillance, that's also another new big thing. With it was being done for polio, but you can do it also for COVID. Wastewater is sampled to pick up where diseases are clustering and prevent an outbreak. And of course, India is the pharmacy of the world. How do you leverage vaccine development, manufacturing, and delivery? It's happening for COVID, it can happen for other diseases. And in all this, maybe there are three words again to think about. It is sustain what has been achieved. You can't pull back. So right now we're all catching up for routine immunization because of the slowdown in the past waves of COVID. But how do you sustain it again? What do you accelerate? Accelerate the prevention and control of non-communicable diseases. It is a comorbid. It is a driver of severity for COVID. It is something that we need to accelerate and improve. And in all this, innovate. So how do you reach out to the community? How do you engage the public to be responsible for health? There's so much blaming in terms of the response, etc. But there are people who have not worn their masks. There are people who have gathered, set up their own parties, weddings, etc. If that was a main driver of gathering of people, is a main driver for this pandemic. Now, how do we actually proceed? Because reimagine, we can sit down and think and ideate. But one big thing, one realization that the pandemic has highlighted is that we need to realign. That's another R, so that we are well prepared or aligned to each other. Health systems, transport, supply chains, emergency coordination. Those were systems that were stretched quickly. And in many ways, its linkages were broken quite early. As each system invests to be resilient, so it's not just health that needs to be resilient to an emergency, but all the other systems. We need to realign with other systems so that it works well with each other. How do urban systems create better health? What would be standards for setting up homes, water, sewage systems, etc.? How can R&D be accelerated to solve old public health problems? Can you imagine the number of candidate vaccines for COVID? And still there is research still being done for TB, and there is, very minimal investment in investing in a vaccine for, let's say, HIV. How can supply chains be streamlined so that it will always have a plan B, a contingency B, C, D? How do we implement a One Health approach? Isn't that such a huge problem? These diseases that are emerging are always zoonotic. How do systems such as wildlife, agriculture, animal industry exchange information with the health sector? In fact, even in antimicrobial resistance, this remains a challenge. How do you implement the One Health approach? We need to all realign and see, and together with that, also foresee and prevent the next pandemic. I think I will end soon. The last is a reset. What does a reset mean? To reset, everyone needs to come together. We need to meet, whether virtual or face-to-face, and address these issues for the benefit of people, so that there's also, it's sometimes thinking of responses, we forget involving populations, people themselves. We're forgetting the public in public health. They are part of preparedness, they are part of response, because a resilient health system will only succeed if society is resilient. So I think I will end there. It's time to reimagine, realign, and reset. So I think these are like posits or possible topics that we can keep continuing to discuss by the panel, and specifics of what can be will be further discussed. So thank you very much for the opportunity.